have something known as map diagrams, or they are also known as geospatial data, that expresses in the form of a map. So if you see, this is the map of a country over here, and it has all the different regions are giving different colors. So for example, if you conduct a survey that says that let's say awareness of physiotherapy among different regions of India. Okay, so maybe in the south there will be more awareness. Okay, maybe as you go towards the north there is lesser awareness. So by indication of different colors, or the different shades of the same color, that will tell us easily uh, that okay, so if supposingly your southern India is in dark blue and your North India is in light blue. So if you have a legend, legend is nothing but your what do we say, the title of the map, not title, the indicator of your particular diagram, the map diagram. So if you say on the legend, then we will easily be able to interpret that okay, south regions people are more aware about physiotherapy than in the northern regions. So maps are invaluable for visualizing geographical distribution of data, such as the prevalence of certain diseases in different regions or the reach of physiotherapy services across a community. So they provide a very quick, intuitive understanding of spatial patterns. Spatial matlab how they are distributed geographically. Next, we have understanding distributions, that is histograms, frequency polygons. So, I hope you have understood bar diagrams. So, if you have a continuous data, that means there is no gaps in between your bars in a bar diagram. A stacked bar diagram is nothing but a histogram. So histograms represent continuous data with data characteristics on the x-axis and the number of observations or the frequency on the y-axis. And it looks like a bar graph, but it does not have any gaps between the bars. Why? Because it is representing continuous data, and it can have unequal class intervals. That means that not necessarily you should have 20 to 24, 25 to 29, etc. You can have 20 to 23, then 23 to 30 also. So histogram gives you that flexibility that you can have unequal class intervals. Now, if you have drawn a histogram and you just all the bars that you have gotten in your histogram, if you mark the midpoints of those bars and join them together, that becomes a frequency polygon. So it is similar to histogram, but they use lines to connect the midpoints of the top of each bar. They are effective for comparing multiple distributions or identifying trends over continuous data ranges. In the next slide, we will see diagrams so you will understand better. And when the bars of the histogram are too narrow to each other, that means if your class intervals are very small, then the frequency polygon that you will make, it will no more be a polygon, it will look like a curve, and that is nothing but your frequency curve. So a smooth version of your frequency polygon used to represent theoretical distributions or generalized from sample data, that is your frequency curve. So I have diagrams over here. So in the extreme left, what you are seeing is your histogram. See that it is a bar diagram, but with no gaps between the bars. And it is very nicely giving the frequency, like the center one is the tallest. So we know that the frequency of that particular characteristic is the most. On the right hand top, what we see is a histogram. Then we have taken the midpoints of the frequencies and we have connected them by dots. And then the first and the last dot we have again connected to the x-axis. That is your frequency polygon. And if your histogram, the class intervals of your histogram is very small and your bars are stacked very close to each other, then your frequency polygon becomes a smooth version of itself, and that is nothing but your frequency curve. When we are tracking trends, that means if you want to see that the number of students passing each year, okay, so on the x-axis you will have the year 2000, say suppose if we want last 10 years, so 2014, 15, 16 till to 2025, and say on the y-axis you have number of students. Okay, so we know that if the line is going somewhat like this upwards, that means it is good. That means more students are passing over time. So this is telling us nothing but the trend. So this is represented by a line graph. So line graph is perfect for showing trends over time or continuous data. For example, tracking of the patient's pain levels over several weeks or monitoring the range of motion. So if we go for pain level, suppose on x-axis you have the VAS score 0 to 10, and on the y-axis you have number of patients. So or if you are seeing only for one patient, then maybe you can have day 1, day 2, day 3 on your x-axis and you have VAS on your y-axis. So if your VAS intensity is going down, suppose on day 1 it was around 8 or 9 and then slowly coming down, then this line diagram will give you a visual representation of stating that yes, your treatment is working and the pain level of your patient is coming down. So this is nothing but showing the trend of the pain over time. So these are your line graphs that track trends. Next, you have scatter diagrams. So whenever you have to show a relationship between two variables, for example, obesity and say developing hypertension. Okay, so these are two variables, obesity and develop and hypertension. They are two variables. When you want to find a relationship between them, like supposingly when you want to make a statement that with obesity increasing, the risk of getting hypertension also increases. So this relationship will be shown best by a scatter diagram. Each point represents a pair of values, allowing easy identification of correlations, like the relationship between exercise adherence and pain reduction. So scatter diagrams tell us about a correlation between two variables. So if your scatter diagram, again, it is going up towards the right side of the graph, then it is stating that the two variables are positively correlated with each other, meaning that when one increases, the other will also increase. And if you have a scatter diagram that goes from the left to right in a downward format, then that means it has a negative correlation. That means that when one variable increases, the other will decrease. So a few points, takeaways. First is choose wisely. Whatever uh, data you have, appropriate visualization based on your type of data and the message you want to convey to the audience, to your target audience, should be conveyed properly. So there are so many options available, but what is best for your audience and the type of data you have, that you should be knowing. Clarity is a key. So always, whenever you have figures, also always have clear labels, legends, use titles so that your data is understandable just by your figure or by your table. And practice and apply. So regularly apply these data visualization techniques in your physiotherapy studies and future clinical practice. So effective data visualization empowers physiotherapists to better understand patient progress, refine treatment plans, and communicate outcomes with precision. So whenever you have, suppose if you have a line diagram showing how your treatment is working, then you also will be able to communicate that with others and with precision. So these are small home takeaway messages, and I would like to thank the Physio TV audience for your listening.
So that's been a very enlightening talk by Dr. Sonam. I thank her for uh, putting light into making the presentation of data and also making it so interesting. Thank you so much.
Thank you, ma'am. Thank you.
I would also like to now tell the Physio TV viewers that from this talk onwards, we also have our postgraduate students who have joined in, and they'll be asking some one or two questions to Dr. Sonam from the talk that she has just taken. So I request Meenal, Pratiksha, and Rasika, who are doing MPT at Sancheti Institute College of Physiotherapy, to kindly join the session by putting on their videos. You can even unmute yourself. Whoever's asking the question can unmute and ask the question.
I have a question that what can be the common mistakes we do, or how can that be avoided while presenting our data related to physiotherapy or data related to patients?
uh main the One of the very common mistake that I have seen is whenever the data is huge, it is large, it is not categorized properly, like having proper grouped data, having proper class intervals for that. For example, if you have a data set of 100 patients and you have weight of the patients, so having it now you cannot start weight of the patients by zero, right? 0 to 5, you cannot have that kind of a category. So you should looking at your data that okay, all your data starts from 50 kgs, so starting from 50 kgs till 80 kgs. So if that is your range, then selecting that particular range and having those particular class intervals, that is very important. And using always using grouped format when you have a larger data sample, that is very important.
Ma'am, could I add to that? I
Yeah, yes,
think
Thank
ma'am,
you.
what
please.
even I have observed, Pratiksha, is that very often the scale itself is not chosen properly. So sometimes there's only a 0.8 difference in the VAS, and it's seen as if it's a large difference, you know?
Yes.
So between group A and group B, because of the scale that we have chosen. So sometimes you need to kind of even put that in perspective. I guess Dr. Sonam would agree that
Yes.
whenever you're presenting, you need to be well distinct about what scale you're choosing on the axis.
Yes, on the axis, if you have a very
Thank
minute scale, then your 4 will look this much and 4.8 will look this much, like what ma'am is saying. So 4 and 4.8 is not a huge difference, but if you visualize it, it will look very big. So scaling of your graphs is important.
Thank you so much, ma'am.
Thank you so much. Dr. Meenal or Dr. Rasika, do you all have anything to ask? Any further questions?
No, ma'am. Thank you.
Yes, ma'am, I have one question.
Yeah, please
Yes.
go ahead.
Yes. Ma'am, which graph would be most appropriate to show improvement? Such if take an example of strength training or endurance training. So, which type of graph is most appropriate?
So if you have something in say pre and post treatment, a bar graph is the best. So you have in a bar graph you will have a pre and post. So if you say suppose strength pre was this much and post was this much, then that will by vision only it will tell your result. So a bar graph is very easy to use first of all, and it is the best when you are going for experimental studies in pre-post analysis. So a bar graph will be best tool for that.
Ma'am, how to differentiate between bar graph and histograph? Which one to use?
So whenever you have a continuous data, you will use a histogram. But whenever you have a discrete data, you will use a bar graph. Let me give you an example here. So for example, if you are saying, suppose pain of the patient, okay. So on one bar graph, you will have, you remove the mean of your data, right? So the mean on one, you have pre, you have 5, and post, suppose you have 3. So bar graph 5 and 3, like that you will see. But if you are using that same kind of data in the continuous format, for example, if you have class intervals like 0 to 1 and then again 1 to 2, so then there is no gap between your bars. That again, if you will represent that in a graphical format, that will give you a histogram. When there is no gap between your bars.
Thank you so much, ma'am.
Thank you so much for solving the queries, and a big thank you to all the 3 MPT students who have joined us today for the talk. I'm sure the data presentation, at least, will be better. They'll be kind of working on their dissertations soon. So I guess this will go a long way in helping them with it. Thank you so
Yes.
much.
Thank
So
you.
from
Thank
the
you,
entire
ma'am.
team of Physio TV here, I would really like to thank and express my heartfelt gratitude to Dr. Sonam Jain. In fact, ma'am agreed for the talk in a very short span of time and has come up with a very nice talk. Another thing that I would like to kind of mention, which I kind of forgot when we were kind of doing the entire introduction, was that ma'am has also been a lead physio and a player at the hockey.
Yes, ma'am.
Yes, so that's one thing. And she's also had a patent for a physiotherapy machine for the hand.
Yes,
So that
ma'am.
is something very unique, and I think it should be mentioned. She has also got an appreciation award for outstanding achievement in physiotherapy with exceptional performance in her PGP CET exam in 2017. And she has also represented Sancheti Institute in Khelo India as a field physiotherapist. So, ma'am, there were many more caps, feathers on your cap, which I kind of forgot to mention, but I thought we should do it before we sign off. So thank you so much, Dr.
Thank
Sonam,
you.
for taking your time. I would
Thank you,
also like to
ma'am.
thank Sancheti Healthcare Academy Chairperson, Mrs. Manisha Sangvi, as well as Dr. Parag Sancheti, who's the chairman of the Sancheti Group of Hospitals. And from the entire Physio TV team here, I would now like to sign off. Thanks so much, and I keep watching and please keep subscribing because we are going to get many more such interesting talks for you in the near future. So
Thank
thanks.
you. Thank you, Sona, ma'am. Thank you.
Thank you.